Hi, thanks for taking the time to visit us at the Center for School Behavioral Health at Mental Health America of Greater Houston. The center's mission is to improve the prevention, early identification, and intervention and treatment of behavioral health issues among students. We do this by providing training modules, lesson plans, and activities that are designed to build the school's internal capacity to infuse mental health into the campus culture. The Center for School Behavioral Health's collaborative works with 30 charter and school districts and more than 80 organizations in the Greater Houston community to implement 37 recommendations for improving student behavioral health. The purpose of this training is to discuss the value of social distancing and how to deal with it in healthy ways. There are 2 professional development specialists on our team who are responsible for facilitating or training student-facing professionals. My name is Sharifa Charles, and I'm excited to facilitate this training opportunity for you because I believe in the work that we do at the center, and it is my hope that more school districts will prioritize mental behavioral health for their students. Let me share a little bit about myself. I'm from the Caribbean island of St. Lucia, so you will be hearing a few different accents. Do not be alarmed. My professional background is in public health education, and I have been facilitating and training since I was 15 years old. Here is where we will be heading today. We will be defining social distancing, identifying the effects of social distancing on our professional, social, and family lives, reviewing the potential negative consequences of social distancing, and identifying methods for preventing or mitigating the negative impacts of social distancing. Here are 3 terms that we use quite often during this time and sometimes interchangeably. Social distancing, which means to create space so those that are sick will not impact those who are well. Self-quarantine, which means if you are well or not infected, quarantining is designed to keep you from contracting the virus. And isolation, that refers to the ill who are distancing themselves to prevent the spread of the disease. During this video, we will focus primarily on these 3 areas of adult life. We all wear many hats, but for this video, we will discuss the impacts of social distancing on your professional, social, and family life. Let's look at our professional lives first. According to the Webster's Dictionary, professional life is defined as a career in industrial or commercial or professional activities, business life, calling, career, vocation, the particular occupation for which you are trained. Many of our respective organizations have asked us to work remotely. Perhaps other adults in your household, family, or community have been asked to do the same. Some have reported experiencing feelings of being disconnected from their coworkers, having to navigate blurred lines of our professional and personal lives, which naturally increases our overall stress levels. Some of us have even been laid off or furloughed, which can quickly cause us financial strain. Recently, Blind administered a study on emotional well-being due to social distancing in terms of loneliness, anxiety, and productivity. There were over 10,000 participants. 52.9 answered yes to increased loneliness during work from home. 56.4 reported experiencing increased feelings of anxiety during work from home. 53% said productivity levels have been impacted due to changes in mental health while working from home. You may feel that you are experiencing one or more of these emotions in response to your experience or of those around you. I'm sure you can think of even more ways where those close to you have had their professional lives changed since social isolation began. It is important to acknowledge the effect of social isolation on our professional lives. By doing so, you'll be able to better address any issues and make changes to remain resilient. Let's now take a look at the effects on our social life. Nicholas Christakis, a social scientist and physician at Yale University, has stated that the coronavirus spreading around the world is calling on us to suppress our profoundly human and evolutionary hardwired impulses for connection, seeing our friends, getting together in groups, or touching each other. The effects of short-term social distancing haven't been well studied, but several researchers shared their thoughts on potential social and psychological impacts. Chronic social isolation increases the risk of mortality by 29%. It is said that social contacts can buffer the negative effects of stress. Lab studies by Holt Lundstad and others have found that having a friend present can reduce a person's cardiovascular response to a stressful task. There's even a correlation between perceived social connectedness and stress responses. On this slide, you will see a list of potential and/or common effects social distancing is having on you. Not only are we unable to congregate at our favorite restaurant, coffee shop, church, or mosque, but we are dealing with feeling increasingly lonely or even tensions with those we reside with. We love them, but it doesn't mean our significant others, kids, and even pets don't get on our last nerve sometimes. We must make mention that the two groups we must pay the closest attention to are our adolescents and elders, or as I like to call them, our more seasoned adults, especially if they have a pre-existing mental health diagnosis. Our teenagers are coming of age post 9/11 and are now living through a pandemic. We see them struggling to adhere to the rules of social distancing, and that can be attributed to many factors. One driving force is their brain development. While their prefrontal cortex is still forming, a typical adolescent can often or periodically make decisions that reflect their belief that they are invincible. Many are mourning the loss of celebrating milestones such as birthdays, prom, and graduation. During this time, we must increase our empathy and engage in dialogue to ensure they understand what is taking place, why it is important to self-isolate, and address any emotions they may be experiencing. When we think of elders, we are generally speaking of those who are 65 years old and above. With this group, particularly those who are not as comfortable with modern technology, we must be mindful of engaging with them in ways that they are comfortable with. Social isolation in seniors has been linked to increased depression and suicidality, as well as increased pro-inflammatory and decreased antiviral immune responses. Mainstream media, such as television and radio, can play an important role. Also, regular phone calls can ensure that they feel connected, cared for, and heard. As our city and nation work to combat COVID-19, our home lives are undoubtedly directly affected. Sheltering in place with our families can lead to lifelong memories of bonding and collective resilience, or even feelings of resentment and unexpected clashes. In a study from 2007, the rate of transmission of infectious diseases within households was shown to be so much greater than between individuals not living together. More than 64 million Americans live in a multi-generational household, and that is about 1 in 5 US residents. Whether you reside with chosen or biological family members, you may have or deal with the following effects: financial hardships due to one or more working adults being affected by the economic downturn, being unable to visit or care for sick loved ones who do not reside in your home but depend on your direct support and care, mourning, canceled family celebrations, like birthdays or rites of passage. You may even be grieving, engaging in annual cultural traditions that you look forward to and keep you connected to your upbringing or beliefs. We must not also forget that within a household, there may be differing theories or clashing ideologies about the pandemic or even our city and national leaders' responses. This can cause unforeseen tension that can no longer be resolved by taking a break outside of the home. The increase in stress levels and pressure, one may even be a witness or directly experience domestic or intimate partner violence. Violence against children may take place whether or not there was history of it in the home. Important notes I would like to make that we can't emphasize enough the importance of keeping in mind that social isolation may exacerbate things for those who are already secluded and lonely. It may also cause many to get into habits of connecting less, which is an issue we are already combating in a world of increased dependence on technology. Undoubtedly, social distancing will have an effect on our mental health. We are social by nature. Some of the common emotions experienced by adults during a crisis situation are hypervigilance, anger, hopelessness, anxiety. Some may also experience increased stress, depression, loneliness, and the exacerbation of pre-existing mental health illnesses. We live in an information-rich world with easy access to the latest statistics about the current COVID pandemic. Correct information is a vital tool, but the gift and curse of our information access is that we can see how others are impacted and potentially internalize their attitudes and feelings. Fear about a disease can be overwhelming and cause strong emotions, and we realize this is not just in our respective areas, but is taking place worldwide. I cannot emphasize enough the need to encourage those among us who have pre-existing mental health conditions to continue with their treatment and be aware of new or worsening symptoms. Let us now take a look at some behavioral signs we can look out for. People should continuously look out for signs of distressed mental health in themselves and others. Some behavioral signs may include fear and worry about their own health, changes in sleep or eating patterns, difficulty sleeping or concentrating, worsening of chronic health problems, increased use of alcohol, tobacco, or other drugs. When we show signs of the onset of a mental health challenge or the worsening of a pre-existing diagnosis goes unnoticed or addressed, there can be some unexpected consequences. Let's review some together. Here are some unexpected consequences you may notice. For this training, I will review 2. Let me bring your attention to the last 2 on the list: the vulnerability to intimate partner, domestic violence, and the violence against kids. With vulnerability to intimate partner, domestic violence, as we discussed before, rising tensions at home could lead to violence between family members. That could be due to issues that were present prior to sheltering in place. Intimate partner violence calls have increased by 6% from February to March in 2020. For example, the Montgomery County's DA office reported a 35% increase in the number of domestic violence related cases being filed in March 2020 compared to March 2019. There is a link between natural disasters and intimate partner violence. Following Hurricane Harvey, there was 64% increase in domestic violence. With violence against children, stress in the home may also impact how adults interact with children. Violent actions or negative communication could occur more often. Some contributing factors can be increased stress, overuse of abuse of mind-altering substances, or even the lack of healthy coping or parenting skills. So far, we've discussed about the effects of social distancing on your professional, social, and family life. We also discuss social distancing's impact on your mental health and their unexpected consequences. Let's review some traditional and creative ways to mitigate those effects. This list is not exhaustive, but a great starting point. Perhaps you have already employed some of these practices or would be open to explore some of these ideas. The different colors indicate the areas of our lives they may assist with the most. Balance in taking care of yourself is a very important thing to keep in mind. Green indicates professional, dark blue indicates social, purple indicates family, and the lighter blue are some general ideas. Take a look and consider at least one you can start today. This list went over more traditional or common ways people cope during social distancing. Let's now look at very creative ways. On this list, I have classified by color too. Some of these can be researched using your favorite search engine like Google. There are also apps that can help support your effort. For example, for the brain exercises, you can download Luminosity. You can also create a free account on Pinterest.com to find DIY projects, at-home spas, and safe family activities. The most important thing is to find the method or methods that best help you and those around you cope while they are sheltering at home. Here are some COVID-19 information resources that we also recommend. Some public health sources are the Center for Disease Control, World Health Organization, and the National Institutes for Health. Some mental health resources are the Harris Center, NAMI. There are also some apps that we recommend in case you are looking to relax and increase your mindfulness during this time. They are all available on iPhones and Androids. In case you are seeking more information, here's a list of references. Thank you for joining us today. For more information about the Center for School Behavioral Health trainings and events, please contact us at csbhinfo@mhahouston.org. We would greatly appreciate if you would take a few moments to take this quick survey so we can continue to improve and provide the trainings you need the most. Take a moment to go to www.surveymonkey.com/r/COVID-SDMH. Thank you again and have a great day.